There are 5 lies that the Tory party and the Lib Dems are telling you about the NHS. And this video is about tackling those lies. Lie 1. It's not privatisation. Well, that's a whopper. Lib Dem and Tory coalition have told us again and again, don't worry, it's not really being privatised. We're just going to contract out all the services that make up the NHS to private providers. But if you unpick that, that is privatisation by another name. But you and I won't know, because these private companies are going to have the NHS logo on everything. So when you go for a smear, or when you go and see a mental health specialist, or when you go to a hospital, these are all going to be privatised. But none of us will know it. And these companies will be able to hide what they are doing because of commercial confidentiality rules. So they won't be accountable to us. Under this, the hospitals are going to be able to take up to 49% of their services to private patients. Lie 2. It's only 6% of the NHS that we're privatising. Well, that's not true. It's more like 11% at the moment. But even if it's only 6%, 7%, 8%, the reason it's only low at the moment in 2015 as we go into the election is because the new systems set up under the 2012 Act haven't yet come into force properly. The clinical commissioning groups haven't yet organised themselves and put things out to tender. Some of the hospitals are not yet private foundation trusts. So the process is going to take some years. It's started, but we won't see the really awful effects for another 3 or 4 years. Lie 3. Private is cheaper. Well, we know from real evidence about private companies that have been used to provide NHS services so far that that isn't true. Private companies like Serco, Virgin Care, Care UK and other companies have taken on contracts, but they have failed sometimes. They've sacked frontline staff like nurses, doctors and orderlies. Then they've gone along and said, we need more doctors, and asked the NHS to provide them. And some of these companies have been completely condemned by the Care Quality Commission. So what we see is that when it's no longer profitable, the companies fold up or they hand back their contract. And guess who pays the tab for all of that? We do, the public. So it's not cheaper in the short term, and it's much, much, much more expensive in the long term, because when everything goes wrong, we, the public, pay. Lie 4. Private is better. Well, that's not true. Why? Because NHS groups of whether it's doctors' surgeries or people working in hospitals or primary care trusts, which have been abolished under the Act, they have a wealth of knowledge about how to provide services, how to work together. It's knowledge that is built up over many, many years, sometimes decades, and all of that will be lost. And a really good example is what happened when various governments privatised social care in this country. We saw care homes that used to belong to all of us in public ownership become private companies and be run by private companies. And time again they failed, or massive abuse was found to happen in companies. Staff weren't properly trained, people weren't cared for. The most sick, the most vulnerable were the ones most badly affected. Lie 5. People don't care. This is probably the most pernicious lie of all, because the Lib Dems and Tories say people don't care as long as they get a good service. But I challenge that. I know lots of people who believe that the NHS is one of the best things that Britain has ever created. They believe that it's our service, it belongs to us, it belongs to the people. And they don't want it in private hands where profit is more important than patient care. They want it in public ownership, and they want all of us to have a stake in it. And there's something else that the Lib Dems and the Tories don't want you to know. Although we're one of the richest countries in the world, we spend less on healthcare than almost every single advanced industrial nation. If we all committed to pay more of the gross domestic product on health, we would have the first-class service that we all deserve and need, and it wouldn't be left to private companies to make profits out of our ill health and our healthcare needs. When you go to vote on May the 7th, there is a choice. You can choose to save the NHS and keep it a public service. These are the parties that have pledged to repeal the 2012 Health and Social Care Act. The SNP, the Green Party, Plaid Cymru, the National Health Action Party and the Labour Party. After the Second World War, Nye Bevan was the Minister for Health under Labour who introduced the National Health Service. He was a Welsh socialist, son of a miner, and he said that the NHS will survive as long as there are folk left with the faith to fight for it. Fight for the NHS. It's our NHS.